Hello and welcome to this video. I'm going to take you through cardiac glycosides, where I'm going to help you understand their role in heart health. Cardiac glycosides are a small group of medicines that improve contractility of diseased hearts. They also reduce the heart rate in such hearts. They occur widely in nature and they can also be prepared synthetically. They are prepared from two plants called Digitalis lanata and Digitalis purpurea. The term Digitalis applies to the entire class of glycosides, which consist of digitoxin and digoxin. They are useful in congestive heart failure, atrial fibrillation, and paroxysmal atrial tachycardia. They are useful in sinus tachycardia caused by congestive heart failure, but are ineffective in treatment of sinus tachycardia, such as that due to fever, anemia, or hyperthyroidism, which are not associated with the heart. So an example of cardiac glycosides is digoxin, also known as lanoxin. It comes as a tablet containing 0.25 milligrams and 0.125 micrograms. It also comes as an injection containing 0.25 milligrams. Digoxin is indicated in heart failure and supraventricular arrhythmias. The dose for digoxin when someone has cardiac heart failure, the initial dose is 0.125 milligrams to 0.25 milligrams per day. And when someone has atrial fibrillation with rapid ventricular response, the dose, we give a loading dose of 1 milligram for 2 hours, 4 times daily, for 6 hours, then followed by maintenance dose of 0.125 daily. The side effects of digoxin includes anorexia, nausea, vomiting, diarrhea, abdominal pain, visual disturbance, headache, fatigue. So digoxin has two mechanisms of actions, that is the direct and the indirect action. On the direct action, digoxin acts directly on the heart muscles to strengthen them, and this is called positive inotropic effect. This increases the contractility of the heart and increases cardiac output. On the indirect action, at lower doses, digoxin slows the heart rate through the activation of the parasympathetic division of the autonomic nervous system, which slows it down and is called negative chronotropic effect. This is vital, especially in atrial fibrillation, because the slowing of the heart allows for slower and more regular contractions, which increases cardiac output. The action of digoxin is increased by verapamil, diltiazem, and amiodarone. So the dose should be halved to prevent toxicity. So digoxin is given with caution in recent infarction, hypothyroidism, in elderly patients, and in renal impaired patients. It is contraindicated in supraventricular arrhythmias caused by the Wolff-Parkinsonism-White syndrome. Cardiac glycosides are potentially toxic drugs, and patients must be closely observed during initial therapy before treatment is started. Patients should be assessed properly. Vital signs should be monitored to serve as a baseline data for comparison. Most important is the blood pressure, the radioapical pulse rate, auscultation of the lungs should be done, as well as abdominal sounds reported. Inspect patient for edema, inspect for jugular veins, and then check the patient's body weight. You should also inspect the skin and the mucous membrane for cyanosis. The doctors should request laboratory investigation and others before administering the treatment. So before administration of the treatment, pulse rate must be counted for a full minute. If the pulse rate is 60 or below, the drug should not be given. The doctor should be notified immediately. The drug should not be given if there is irregularity of the pulse. The drug should not be given if there is a marked decrease in the pulse rate. If the drug is given through IV, then it should be given very slowly. If it is given through IM, then the sites should be changed. So during digitalization, the blood pressure and the pulse should be checked every 30 minutes depending on the condition. The patient should be warned of the side effects of the drug, and they should be informed that their weight will be checked on a daily basis.